This video will demonstrate the recommended personal protective equipment for COVID-19 procedures in the operating room, with an anteroom or hallway if anteroom is not available, for aerosolized generating procedures. Some examples of aerosolized generating procedures are intubation, extubation, code blue and CPR, open suctioning, bronchoscopy, nasopharyngoscopy, pharyngeal and airway surgeries. Please note this is not an exhaustive list. The recommended practice for these aerosol-generating medical procedures is airborne droplet and contact precautions. Note, the portal of entry for COVID-19 is through nose, mouth, and eyes. Clean surface with disinfectant, allowing the appropriate wet time. Gather the required personal protective equipment, which includes shoe covers, N95 respirator, full face shield, blue bouffant. Inspect each equipment for any damage prior to donning each piece. Ensure PPE observer is guiding the healthcare worker through donning and doffing process through the checklist. To begin, remove all jewelry, staff badges, stethoscope, and other loose items. Leave these items outside the anteroom or in a locker. Inspect personal protective equipment for any damage prior to donning each piece. To begin, put on shoe covers. Next, perform hand hygiene. Perform hand hygiene slowly for 15 seconds. Be sure to get nail beds and fingertips, web spaces, thumbs, back of hands, and wrists. Hand hygiene with alcohol pump is the preferred method. Use soap and water if hands are visibly soiled. Continue rubbing until hands are completely dry. If wearing glasses, remove them. Put on fit tested N95 respirator with bottom strap on back of neck on bare skin and top strap on crown of head. Seal respirator by placing both of your middle fingers at the bridge of your nose and use your index fingers to mold metal strip along the sides of your nose and cheeks. Perform seal check by placing your hands below your chin and exhale quickly. If you feel leakage, readjust the fit of your N95 respirator and perform another seal check. Repeat with hands at side and top of respirator. Wear your glasses. Put on blue bouffant. Do not wear cloth head coverings. Put on full face shield with foam band resting in the middle of forehead. Perform a final PPE checklist by doing 360-degree to the PPE observer. Ensure there are no breaches. You are now ready to complete your surgical scrub and enter the operating room through the anteroom or the hallway if anteroom not available, where you can sterilely gown and glove. The doffing of personal protective equipment poses the highest risk of transmission of COVID-19 to healthcare workers. The portal of entry for COVID-19 is through eyes, nose, and mouth. Make sure you take your time to remove your PPE slowly and carefully. While in the operating room, ask for assistance to untie your surgical gown. The surgical gown and glove is removed in the operating room because it is visibly soiled. Remove gown by slowly touching the outside of the gown while facing linen hamper. Roll slowly inside out in a ball and place into hamper. Remove gloves using glove-to-glove, skin-to-skin technique and place in garbage. Perform hand hygiene. The scrubbed personnel may now enter the anteroom or hallway if anteroom not available. Make sure travel is restricted during the doffing process in the hallway. The scrubbed personnel may now enter the anteroom or hallway if anteroom not available. Ensure travel is restricted during the doffing process in the hallway. Perform hand hygiene. Put on clean pair of gloves. Remove both shoe covers by grasping back of shoe cover and pulling off towards the back. If shoe covers are grossly contaminated, this process can occur in the operating room. Remove gloves using glove-to-glove, skin-to-skin technique and place in garbage. Perform hand hygiene. Remove full face shield grasping straps at back of head. Lean forward. Keep chin up and close eyes. Remove slowly and place in garbage. Do not touch front of face shield. Perform hand hygiene. Next, remove blue bouffant by grasping back of cap and pulling off towards the back, avoiding the face. Perform hand hygiene. If wearing glasses, remove glasses. Remove N95 respirator while facing garbage. Remove neck strap slowly by grasping lower strap around the neck first. Then the other strap by grasping the strap on top of the head. Do not touch the front of the respirator. Perform hand hygiene. Replace glasses if wearing them.